Hello everyone, welcome to Nurse Bestie Explains. Today we will see what is staffing in nursing. Staffing is the systematic approach to the problems of selecting, training, motivating and retaining professional and non-professional personnel in any organization. So the meaning of staffing, it is a systematic approach. So by following few steps in a systematic way to the problems of they handle selection, training, motivating the employees and retaining the professional and non-professional personnel in any organization. Staffing refers to recruitment, selection, development and compensation of subordinates. So staffing includes a systematic process which has a recruitment. First step is recruitment. That is recruiting the staff under one organization, selecting them and developing them. That means giving training and developing their skills and knowledge and compensation for doing their job. The organization will pay the compensation of subordinates. This definition is according to Theo Herman. Second one, staffing is the function. It is one of the function by which managers build an organization through the recruitment, selection and development of individuals as capable employees according to McFarland. So what he says, it is the function of the managers who are in administrative level in any organization to build an organization. So to run the organization, they need staffing. So which means through the recruitment. Staffing includes few steps like recruitment, taking the staff members, selecting them, calling them for interview, selecting them by conducting interview or some test, and after selection, the whole group, whoever got selected into the job, they will be given training in their skills or knowledge, that is for the development of individuals to whichever job they are going to take as a staff nurse or head nurse to work in that hospital. Whatever skills required for them, they will give training to make them capable employees. This is the definition of staffing. After the definition, next topic is objectives of staffing. There are 8 objectives of staffing in nursing. First one is provide professional nursing staff in all units. So as a nurse manager or nursing superintendent or nurse administrator in any working hospital, the first objective of staffing in nursing is to provide professional nursing staff in all the units like general ward, OPD, operation theatre, wards, everywhere providing the required amount of nurses. Second one, provide sufficient staff to permit a 1:1 nurse patient ratio for each shift in every critical care unit. Okay, so in critical care unit or intensive care unit ICUs where the nurse patient ratio will be maintained 1:1, one patient for one nurse. So according to that, sufficient staff should be provided. To provide this percentage or ratio of staff, we need to do staffing. Sufficient nurses has to be recruited in that particular hospital. Provide sufficient nursing staff in general medical, surgical, obstetric, pediatric and psychiatric units to permit 1:5 nurse patient ratio. Okay, so in general wards like medical, surgical, obstetrics, pediatric, 1:5 nurse patient ratio is being maintained on a day and afternoon shift. So not only nurses, you should provide in only one shift sufficiently. Okay, even in the morning shift, night shift, even afternoon shift, you have to equally divide according to the requirement. When you see the night shifts and 1:10 nurse patient ratio on the night shift, if you compare with morning or afternoon to night shift, percentage ratio of the nurses is 1:10. It changes. And fourth objective is it involves the head of the nursing staff and all nursing personnel in designing the department overall staffing program. So who designs this? Whom to select? What should be their qualities, what should be their educational qualification, salary, everything will be decided by administrators in the higher officials of nursing department, like nursing personnel and higher nursing staff. They involve in this. They design the department overall staffing program. Then empower the head nurse to adjust work schedules for the unit. So the head nurse who is in charge for that particular ward, she has to be empowered to adjust work schedule. She will plan the rotation, how many nurses to work in each shift. Then inform each nursing employee that request for specific vacation holiday time will be honored within the limits imposed by patient care and labor contract requirements. So whoever nurses working in that particular ward, vacation, whatever leaves they are able to take according to the labor contract requirements. For example, 12 CLs in 1 year, 6 sick leaves, or 1 sick leave, 1 CL per month. According to those rules, they will be given the leaves according to that. Then last objective is reward employees for long-term services by granting individual special time requests on the basis of seniority. Rewarding the employees, whoever nurses working in that hospital for a long period, granting them or giving them some rewards on every special time request on the basis of seniority, like once in 5 years or once in 2 years, they should be rewarded. Senior employees should be rewarded according to the seniority. Okay, so these are all the objectives of staffing in nursing. Next one is functions of staffing. Identifying the type and amount of service needed by agency client. So whoever we are expecting to work as a nurse, staff nurse in any hospital, identify the type, what type of nurses we want, their qualification and amount of service. What type, general shift or any one shift or any shift they have to work. So that specific requirement you have to identify needed by the agency client. So the hospital which where that nurse is going to work, so what is the requirement or type of staff they are looking for, that has to be identified. Then determining the personal categories that have the knowledge and skill to perform needed service measures. If you are looking for a staff nurse who need to work in ICU, so what skills she has to have, so determine those personal categories. So she should be expert in blood drawing, taking care of critically ill patient, ABG analysis, she should perform, etc. Many other procedures and their knowledge about various critical disease conditions. She should have skills to perform needed services. Then predicting the number of personnel in each job category that will be needed to meet anticipated service demands. So predicting the future, the number of personnel in each job category according to nurse patient ratio. So how many nurses we require, like how many ICU nurses, how many OPD nurses, general ward nurse. So all that category that will be needed to meet the anticipated service demands. According to that, you have to predict the number of personnel required for each job. Then obtaining budgeted positions for the number in each job category needed to service for the expected types and number of clients. Obtain the budgeted positions. Like the organization has set some budget. So we have set some budget to take the nursing staff. So according to that budget, how much staff they can recruit. So that required staff has to be recruited. That is one function. Then recruiting personnel to fill available positions. Selecting and appointing personnel from suitable applicants. So whoever apply for the posts, by scrutinizing all the applications, we have to select the recruiting personnel to fill available positions. For example, we need 5 ICU nurses. So from the applications which we received who are able to work in ICU, we have to select them. So available positions and suitable applicants we have to approach. Then combining personnel into desired configurations by unit and shift. Okay, so combine the personnel into desired configurations by unit and shift according to the shifts, morning shift, evening shift, night shift, according to the personnel available. Senior most nurses, if 2 members are available, night shift. Others can be juniors or with 1 or 2 years experience. With the guidance of the senior nurses, that shift work they can handle. Like that, we have to combine personnel into desired configurations by unit and shift, orienting the personnel to fulfill assigned responsibilities. After joining, immediately will not post them into the wards. First, wherever it is in any organization, either it is an educational organization, hospital, or any new college, school, wherever, the students first require orientation. The full complete building or departments where they are going to work, complete awareness about that place they need to get. So, orientation. Then, assigning responsibilities for client services to available personnel. So after orientation phase is over, you can take the nurses to the whichever what they are going to do in future. Assign the responsibilities. So 1:1 ratio in ICU means assign one patient to the nurses. Show them where the equipment is available, all the other facilities, where the lab, everything which is known, aware of it, she will be able to perform her responsibility. So assigning the responsibilities for client services to available personnel. So these are all the functions of staffing. These are all the responsibilities we have to do functions after we recruit the staff. Thank you.